Salam, hello everyone. I am Dr. Asad Saleem, here I discussing about sexual health. It is a vital part of overall well-being for both men and women. It's about feeling good physically, emotionally, and mentally when it comes to sex and intimacy. A healthy sex life can boost your confidence, strengthen your relationships, and bring joy to your life. However, many people experience challenges with their sexual health at some point, and it's important to remember that you're not alone. Open communication with your partner is crucial when facing sexual health concerns. Talking about your needs and desires can deepen your connection and help you navigate these issues together. Remember, seeking help is a sign of strength, and healthcare professionals are there to support you in finding solutions. Understanding the complexities of sexual health is the first step towards improving it. By educating ourselves and breaking down stigmas, we can create a more open and supportive environment for everyone. Let's delve into some common sexual health concerns that men may face. Erectile dysfunction, or ED, is a condition where a man has trouble getting or maintaining an erection firm enough for sexual activity. It can be caused by various factors including stress, anxiety, and underlying health conditions. Premature ejaculation, or PE, is another common concern, characterized by ejaculation occurring sooner than desired during sexual activity. This can lead to feelings of frustration and self-consciousness for men. Fortunately, there are effective treatments available. Low libido or reduced sexual desire can also affect men. It can stem from hormonal imbalances, relationship issues, or lifestyle factors such as stress and lack of sleep. Addressing these underlying causes is essential in managing low libido. Remember that these challenges are more common than you might think, and there's no shame in seeking help. Women also experience a range of sexual health concerns that can impact their well-being. Low libido, similar to men, can affect women's desire for sexual activity. Hormonal changes, stress, and relationship difficulties can all contribute to low libido in women. Vaginal dryness is another common issue that can cause discomfort or pain during intercourse. It often occurs due to hormonal changes related to menopause or certain medications. Painful intercourse, also known as dyspareunia, can be caused by various factors including infections, endometriosis, or vaginismus, which is a condition involving involuntary spasms of the vaginal muscles. It's essential for women to remember that they don't have to suffer in silence. Talking to a healthcare provider can help identify the root cause of these concerns and lead to effective treatment options. Now let's explore some clinical factors that can contribute to sexual health challenges in both men and women. Diabetes can damage nerves and blood vessels, potentially leading to ED in men. High blood pressure or hypertension can also restrict blood flow and contribute to sexual difficulties. Cardiovascular disease, which affects the heart and blood vessels, can impair blood flow to the genitals, impacting both men's and women's sexual function. Hormonal imbalances, such as low testosterone in men or estrogen fluctuations in women, can also significantly impact sexual desire and performance. Lifestyle factors play a crucial role as well. Smoking, excessive alcohol consumption, lack of physical activity, and poor diet can all negatively impact sexual health. Section 5. Recognizing the signs, common symptoms of sexual concerns. Being aware of the signs and symptoms of sexual health concerns is essential for early detection and treatment. One common sign is decreased libido, which involves a reduced interest in sexual activity. This can manifest as a lack of desire or a decrease in sexual thoughts or fantasies. Erectile dysfunction in men, as mentioned earlier, is characterized by difficulty achieving or maintaining an erection. Vaginal dryness in women can lead to discomfort or pain during intercourse, and may be accompanied by itching or burning sensations. If you experience any of these symptoms persistently, it's crucial to consult a healthcare professional to rule out any underlying medical conditions. Section 6. Seeking answers, diagnostic tools and assessments. When you consult a healthcare provider about sexual health concerns, they will likely use various tools and assessments to reach a diagnosis. Taking a thorough medical history is essential to understand your overall health, including any pre-existing conditions or medications you're taking. A physical examination can help your doctor assess your general health and check for any physical signs related to your sexual health. Blood tests may be ordered to check hormone levels, blood sugar, and other factors that could be contributing to the issue. In some cases, your doctor may recommend further evaluation by a specialist, such as a urologist for men or a gynecologist for women. Section 7. Empowering solutions, treatment options and therapies. The good news is that there are many effective treatment options available for sexual health concerns. Medications such as phosphodiesterase type 5 inhibitors for ED or hormone therapies for low libido can be beneficial for some individuals. Lifestyle modifications such as quitting smoking, reducing alcohol consumption, exercising regularly, and managing stress can significantly improve sexual health. Counseling or sex therapy can be incredibly helpful in addressing the emotional and psychological aspects of sexual difficulties. The most suitable treatment approach will vary depending on the individual and the underlying cause of the concern. Section 8. Nurturing your sexual well-being, lifestyle and dietary advice. In addition to seeking professional help when needed, there are many things you can do on your own to support your sexual health. Maintaining a healthy diet rich in zinc, selenium, magnesium, and multivitamin antioxidants in fruits, vegetables, whole grains, and lean proteins can improve blood flow and overall well-being. Engaging in regular physical activity can boost circulation, reduce stress, and enhance body image, all of which contribute to a healthy sex life. Managing stress through techniques like yoga, meditation, or deep breathing exercises can improve both mental and sexual health. Remember, prioritizing your sexual health is an investment in your overall well-being. By making healthy choices, seeking support when needed, and communicating openly with your partner, you can cultivate a fulfilling and enjoyable sex life. Make sure to like, share, comment on video, and subscribe my channel at Asad Saleem 1414 for more medical insights.